Can you hear us?
Yeah.
Okay.
The next case that we have is of a 40 years old female who presented to us with complaints of abdominal pain and weight loss for past 3 months. Her CT scan shows a mass in head of pancreas of 2.8 into 2.4 centimeters. For evaluation of that mass, we are doing this EUS.
Can you just repeat the history a little? 'Thank you, ma'am.
40 years old female presented to us with on and off abdominal pain and weight loss for past 3 months. Her CT scan abdomen with contrast shows a 2.4 into 2.2 centimeters mass in head of pancreas.
So it's CA head of pancreas likely.
Suspected, yeah.
लगा दिया आपने माइक? Can you hear me? Everybody can hear me?
Yes, we can.
Okay. So this looks like this is the last upper EUS case for the day. So I know all the candidates and all the observers probably we very successfully have confused them enough that they, by the end of the day they probably don't know what's happening.
You can talk about yourself, Dr. Mustafa, as I have clarified everything.
So what we're going to do is, like with this case, we're going to try to simplify. I'm going to just go through like just the simplest way to do it. Just few things before we start I want to mention about that. The main purpose is goal is the pancreas here. So just remember that if you are looking at the uncinate process, that's D2. If you are looking at the head of the pancreas and papilla, mainly D1 and D2, body and tail gastric image are from the stomach, and for the celiac artery and SMA GE junction, a little bit below the GE junction. So we're going to try to simplify like that. So and try to make it more understandable.
Yeah, I guess Dr. Saad Niaz is standing on your head.
He's standing what?
He's standing on your head, so you have simplified the thing.
हो गया जी लीड लगा लो आगे उसके सैट्स आ गई हैं, वो नंबर नहीं आ रहा उसका, आ रहा है? अच्छा आपका उधर आ रहा है, ठीक है, सही है। Okay. So yeah, intubation is we have talked about multiple times, just like a ERCP scope. It's a little bit different than ERCP scope, but the intubation is not much different. So it's more little bit. Some people like to do it under some view, other people do it with a feel. So it's really a combination of both of those. So mostly it's a feel because it's a kind of a side view camera, and to some extent there has to be some view there as well. It's not going smoothly.
Yes. Feelings
Okay. Resistance है, अगर resistance है तो then don't do it. ठीक है. Okay. Needs to go very smoothly. ठीक है. There should not be much resistance. It's gonna be just like going very smoothly. अगर आपका जो है ना, I think maybe too much wheel movement there. Okay. It should be moving very smoothly. Okay. दोबारा से ट्राई करें, start over. Yeah, well, that's the you're in the right place right there, but you need to keep the जा रहा है या नहीं? ठीक है, good. ठीक है, आप जो है ना वो थोड़ा सा just inflate a little bit, nice, beautiful. ठीक है, go to the GE junction. Okay. Okay, yes, just stop there. So you're right at the GE junction. Okay, this is a good position of the scope. You're going to move back a little bit. Okay, good. थोड़ा सा एक step पीछे हो जाए, थोड़ा सा. Good, excellent. So look at the GE junction. थोड़ा सा clean the lens. Okay, थोड़ा सा inflate करो थोड़ा सा, ताकि नजर तो आए ना कहाँ पे. ठीक है, excellent. So go into the stomach. Okay. Move towards the, rotate it a little bit this way, ठीक है? Not your body, just the scope, ठीक है? And go in, big wheel towards you, okay? And suction. So just going a few centimeters below the GE junction towards the opposite wall of the stomach, okay. Big wheel towards you takes you straight to the left lobe of the liver. From here, just start rotate. ये इसको ज़रूरत नहीं है, यानी कि आपने पूरा नहीं, just let it relax, and what you do with this, take a look at this number. Like right now, nothing is happening, ठीक है? So straight, you see that? That starts moving now, okay? So here, come back a little bit with the scope, big wheel towards you, please, okay? Start rotating to the right until we get to the aorta. Keep going, nice, 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 ठीक है? So we're going to just left lobe of the liver. The next step we're going to take a look is at the aorta. Just find it. Keep going until you get to the aorta. I think you may be a little bit too outside. So, okay. So that's, you are way back into the esophagus quite a bit, because we're starting to see the left lobe of the liver. Let's try that. So you see there should not be much trauma there, okay? Go in. There's a lot of trauma right there, so it should not be like that. Okay, here, now big wheel towards you again. Okay, let's try again. So just rotating to the right, okay, stay there. We are seeing the pancreas already, so let's get to the aorta. Right there, okay. Take it, yeah, bring it there. नहीं मेरे भाई, इसको रोटेट करो, आप सिर्फ इसकी मूवमेंट इधर कर रहे हो, उधर कुछ भी नहीं हो रहा. So whatever you do it, that needs to be transmitted down. Okay, right here, ठीक है? आपका aorta नजर आ रहा है? Aorta right there. You see the celiac. अब आपने your goal is to keep the celiac just underneath that, ठीक है? तो किधर ऐसे इसको आपने चाहे राइट या लेफ्ट जो मर्जी आपको करना पड़े, द गोल इज टू कीप द celiac underneath, जो भी आपने जो है भी मूवमेंट, ठीक है? नाउ स्लोली एडवांस, slowly advance. The left gastric is big wheel towards you a little bit. Left gastric is coming right here. Okay. And now advance for the big wheel towards you, please. Big wheel towards you. Okay. So right here, you see that right there. Just slowly advance. Now release the wheel a little bit. Release it. Release it. Release it further. Okay. So let's try that again. Okay, pull it back a little bit. Pull it back. Let's ये हो रहा. आप इसको ना बहुत ज़्यादा resistant दे रहे हो movements को, ज़्यादा resistance नहीं, relax it, ठीक है? Here. इसका लगता है काफ़ी एट्रोफिक है पैंक्रियास. दोबारा सीलिया को दोबारा ढूंढें. I'm going to take the Doppler off, ठीक है? सीलिया को दोबारा ढूंढें. एक मिनट ज़रा. Can anybody comment on this? What is this structure right above the aorta? Anybody in the audience?
Yes, yes. That's the left crus of the diaphragm.
Okay.
That's the response of the audience, not mine.
Okay, sounds good. Okay. So let's find that celiac now. तो आपका diaphragm अभी नजर आ रहा है. तो that means you need to go a little down below that. ठीक है? आपका celiac किधर गया? आपका aorta किधर गया? Okay. आपके वो you're lost again, right? ठीक है? Lost. So that's okay. You come back to the place where we started from. Find the aorta again. Find the aorta again. Aorta, please. Okay. आप जो है ना सिर्फ वहाँ पे बैठे हुए हो, कुछ कर नहीं रहे, तो we have to find the aorta again. ठीक है? If you are lost, left lobe of the liver there. Now rotate it to the right. Rotate it to the right. Good job. Keep going, keep going, keep going. Let's find the aorta again. Okay. आपकी scope देखो कहाँ पे है. आप you are way high up into the esophagus, so you won't find any the structures you need are looking for really. Okay, ठीक है. अब यहाँ से दोबारा big wheel towards you, big wheel towards you. Now you got the left lobe of the liver. यहाँ से rotate करें right की तरफ, rotate करते जाए, करते जाए, करते जाए, करते जाए, करते जाए, कर रहे मज़ीद. So आपको नज़र नहीं आया, ठीक है? तो right there, good, excellent, ठीक है? आप celiac किधर है? इसको rotate, celiac is right here, ठीक है? दोबारा इसको लेके आए celiac को view में. Good, excellent. So now, no, दोबारा लेके आए view में. Okay, let's follow that now. ठीक है? Release the wheel a little bit and gently advance the scope, so it can take you to the pancreas. Okay. एक मिनट जरा दिखाना है. Does anybody notice anything here, like with regard to the pancreas? Do you see any pancreas there?
Yeah, it's an atrophic pancreas. Yeah.
Extremely atrophic pancreas, yeah. Extremely, like this area is of the pancreas right here. But there's really no major pancreatic tissue. That's what it looks like right there. So that also is very worrisome in a way that that indicates likely that there is a mass in the head of the pancreas.
So secondary to the
Just
tumor
secondary,
there.
yeah, secondary to the tumor, and you see a lot of vasculature there as well.
So it's possible it's portal vein thrombosis?
Correct.
Or?
Yes, exactly. That's the possibility we need to keep in mind. So here we do see a SMV. You see a little bit pancreas above that, but some of it is maybe even a thrombus in there. It's like it's a really atrophic. Okay, let's do this.
So
let's go straight to the duodenal bulb and look for the mass. Okay. Go straight there to the duodenal bulb. Okay. Big. थोड़ा सा lens clean कर लो ना ताकि पता चल जाए कहाँ जा रहे हैं, ठीक है? Okay. So when you go into the bulb, okay, inflate. Okay, go into the bulb. You are still in the stomach. Okay, go. Big wheel towards you, right there. Look for the apex. Okay, थोड़ा सा इसको जो है ना अगर किधर है apex? Right there, ठीक है? एडवांस तो नहीं, आप इसको हाथ छोड़ना नहीं है. मेरा मकसद ये है दूसरे हाथ से पकड़ने का ताकि आपको पता चले कि मूवमेंट क्या हो रही है. अगर आप छोड़ के बैठ जाओगे तो फिर तो नहीं पता चलेगा ना. Big wheel towards you. Okay, ठीक है? You see any of the landmarks right there? So rotate it to the right. Rotate it to the right. थोड़ा सा यहाँ पे रुक जाए, ठीक है? मैं जो है ना अभी डॉपलर डालने लगा, ठीक है? ये कौन सी स्ट्रक्चर है यहाँ पे? आपका Okay, that's what it looks like, right? There is no flow in there. So let's follow that. Big wheel towards you. अब सारी एयर है, आप ना सक्शन यूज़ नहीं कर रहे, ना ही आप बैलून यूज़ कर रहे हो, तो अगर आप एयर डालते जाओगे ना तो फिर तो कुछ नहीं नज़र आएगा EUS में, ठीक है? फिर आप सिर्फ एंडोस्कोपी कर सकते हो, EUS तो नहीं कर सकते उससे. अब फॉलो दैट. अब वो दोबारा बायोडक्ट को ढूंढ, ब्रिंग दैट बैक. अब देखें आप कहाँ पे हैं. यू केम रियली बैक इनटू द स्टमक, ठीक है? तो अब दोबारा डुआर्नल बल्ब में जाओ. Big wheel towards you. Big wheel, thank you. Okay. So let's find that again. तो इधर से डुआर्नल एपेक्स पे जाके, ओके, बायोडक्ट आगे नहीं यहाँ पे, ठीक है? अब अगर मैं इसके ऊपर फ्लो डालूँ तो आपको फ्लो नज़र नहीं आएगा, ठीक है? अब इसको टू फॉलो इट टूवर्ड्स द पेपिला, ठीक है? Big wheel towards you, yes, and start rotating it to the right. Okay, without losing that. Okay, without losing that. Without losing that. Keep going. Keep going. Keep going. Keep going. Good. 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 Keep going. Keep going. Yeah. So it's starting to disappear in that area. So there's something in this area. Okay. Up follow that backwards. Opposite of what you just did. Okay. Keep going, keep going. Push the scope in. Okay. Push the scope in. Okay. That's going up, so you have to release the wheel a little bit. ठीक है? Okay. इनकी एज कितनी है पेशेंट की? Okay. Keep going, keep going, keep going. So rotating. ठीक है? जी? Release the wheel a little further. Okay. That's a liver highland, ठीक है? Now go back there from there. Now let's try to find the pancreatic orifice when you go back there. Keep going, keep going, keep going. ठीक है? पेपिला की तरफ चलते जाएं, चलते जाएं, चलते जाएं. Big wheel towards you. Okay. Does anybody see any mass yet?
The pictures are a little dark for us, but you may be able to see it, but we are not able to see.
No, it's not very apparent yet.
Yeah.
Here either.
Yes,
so,
yeah,
okay, let's go to the second part. Endoscopically. Good. Keep going, keep going, keep going. Okay. Big wheel towards you. Okay. Good, 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 good. Okay. So, yeah, sir. Now, reduce the scope. Reduce the. इतना कुछ करने की ज़रूरत नहीं है कि आपको जो है ना सर पे उल्टा लटकना पड़े. So just small wheel away from you. You can lock it until you reduce the scope. ठीक है? Reduce the scope. reduce the scope, reduce, ठीक है. तो वो बहुत वो वाला जो steps you are beyond that step, okay, ठीक है. अब इसको unlock ज़रूर करना है आपने, ठीक है. Now big wheel towards you. You're falling back. Okay. Big wheel towards you. Okay. Now go back to the second part of the door now. Okay. Good. Small wheel away from you and reduce the scope. When you reduce the scope, then you rotate the scope a little bit to the right. Good. Okay. Either we can see the papilla and put the transducer on that, or okay. अब इसको maintain रखो ना, आप बार-बार you are falling back. Okay, ठीक है. So big wheel towards you. Big wheel towards you, please. Okay, suction the air. Okay. Now let's start looking for the landmarks. Okay. थोड़ा सा दूर हो जाओ, ठीक है. Start looking for the landmarks and start rotating and start pulling the scope back, ठीक है. Start looking for the landmarks. Good, excellent. Keep going. Keep rotating to the right or left. So here something came, right? Yes. ठीक है. Big wheel towards you, please. Big wheel towards you before you fall back. You're gonna fall back again. Looks like. Okay. Here it looks like this is the aorta. And do you see some structure over there? Looks like that's the viaduct, right? Okay. So rotate it to the right from here. Rotate it to the right. Nice. Right there. And pull. Big wheel towards you. Maintain it, please. This is the viaduct right there. Looks like a pancreatic duct right at the bottom right there. And we don't see any mass there. It's just an atrophic pancreas. Okay. Don't see any mass right there. From here, just stay there. You see the viaduct right there? Okay, rotate to the right. Stop there. Okay, you see a small pancreatic duct right there. Let's go back. Rotate to the right, to anti-clockwise. Viaduct right there. Rotate further. Stop there. Aorta right there. Rotate further. Big wheel towards you. Maintain. Try to maintain that. So it's we don't see any structure on that. So I think you probably lost the position. Let me take a look. I haven't seen any mass, by the way, yet. And even though the pancreas look extremely atrophic, and this is a portal vein here. You guys hear me, right? Anybody wants to comment on that?
Yeah,
what's in
we are
here? Yeah, what's in here?
Yeah. Okay. Anybody comment?
You see the portal vein right
yeah,
there.
That's the portal.
Yeah, very prominent portal vein. And
do you have a flow in it?
Let me put on flow for you. You see the
Yeah,
flow?
okay. So its wall seems to be a little thickened there on the,
Okay.
Yeah,
Yeah.
so that's a partial clot there?
Yeah, that's a partial clot, exactly. That's what it looks like. And if you look at the, I don't know if they are seeing this clot as a mass in the head of the pancreas, because I don't see any mass in there.
Right.
And if the other thing is, if you look at the bile duct, that's not dilated. You expect the bile duct to be dilated, and but you don't really see that. So here we do see this clot inside the portal vein. There is a flow. You don't even need to put a Doppler on that, and you see a blood flow in that.
You have the eddy currents there.
Yeah, exactly. And here is the splenic, right there. SME is right there. So it's right at the confluence. There is like a clot in there. Overall, I have not really seen any mass yet in the head of the pancreas.
Yeah. Can we follow the PD and then see how it goes?
And PD is so small, really. Yeah. You don't even see much of the pancreatic tissue. Here, you see some features of chronic pancreatitis. You see that right there.
Looks like a Swiss cheese.
Yeah. Like there are some foci strands, some lobulation there. The pancreas is extremely atrophic looking, and having with that, but there's no ductal dilation really of the pancreatic duct or even the bile duct. And what's the patient's liver test? Anybody knows that? LFTs? That's the gallbladder right there. let me go to the second part and let me take another look from that side, just make sure. So when there is a confusion about that, like there is a no mass, then you really have to be more careful and take a look at the pancreas from where all the different angles.
Bilirubin 1,
Bilirubin is
0.1.
G.
And
And
Khalid, is there a note there?
just let me take a quick look at the.
103 and
Okay, so all the LFTs are normal, completely normal, no problem anywhere.
Okay. This is just like a chronic pancreatitis.
A chronic pancreatitis, and this is the one you are talking about,
that's
right?
right,
That's a very benign looking lymph node. And there was another one too, right there it is, and maybe right there is the aorta, you see that. Lymph node periaortic are close to the
Khalid?
hilar area.
For
This
the
is-
audience, can you tell me why, other than size, you think this is a benign lymph node? If
Okay,
it-
yeah, let me go back to the lymph node just a
just-
second.
just
I'm
for
going to
everybody
freeze
else.
it a little bit.
Yeah.
Okay. So if you look at the lymph node, compare that. This is compare that with this scope itself, and compare that with the tissue right here. So if and look at the shape of the lymph node, it's kind of a irregular lymph node. It's not round lymph node. It's more like a oval or elongated irregular lymph node. And the tissue itself, you see white strands in there. I don't know how much it's projecting well. It's white and black
It
kind
is
of.
a bit heterogeneous. It's
Yeah,
certainly not,
heterogeneous, or more like towards the isoequic. And the like irregularity of the and oval shaped, and like not well formed, not round, and isoechogenicity or heterogeneity, these are the features of benign lymph node or inflammatory lymph nodes. If the same lymph node was really hypoequic, a little darker, with no really white bands in there, and it was well rounded, then you start worrying about it being a malignant lymph node. Okay. So here, if you look
So-
there, this is the aorta right there. I'm in D2. There's a IVC right on top of that. If I go further to the left, then I should be able to see a kidney right there. You see that? Right there is the right kidney, IVC, aorta. And when I see the aorta, I'm going to start paying attention to this corner, and I already start seeing some ductal structure right there. I will put a Doppler on that. There should not be a flow in that. You see that there's no flow in that structure right here, okay? There's no flow. There's a vessel above that, but not here. This is a really atrophic, very atrophic pancreas. And there's no I'll take the Doppler off.
So was it on the CT they said there's a mass?
But there is a clot in that portal vein. So what I'm wondering is if they are seeing that, where did they say in the CT, in the head of the pancreas, right?
Yeah, that's what I was
Body, distal
told,
body.
that I haven't seen the CT here.
In the distal body.
Distal body, that's what they. Okay, so here at least we don't see the mass for sure. So did they say a distal body, you said? And you see the bile duct right there? That's nice and clean. There's no, no
Also having non-sclerotic foveal hypertension, having varices, rod band.
So Khalid, in D2,
yeah.
you just go from one movement to the other, and just little pullback, and that's how you reach.
Yeah, and also make sure the wheels are unlocked at
yeah.
that point. So
Yeah.
it's just a right. So the same 5 structures you want to take a look at it is like aorta. Find the aorta from D2, and from on the right side of on the screen of the aorta is going to be bile duct and the PD. On the left side it's going to be IVC and the right kidney. So now I think they're telling me that they saw a mass in the body of the pancreas. You see that clot?
Yeah, that was nicely shown there. You
Yeah.
just freeze that for a second.
I will just so this is what they. I'm gonna put a Doppler first
Yeah.
there, okay? So here you see that it's a big clot, or could it be really a mass itself? I think it's right here. It looks more like a clot. Let me tell you why I am saying that. but we have to do I think we may have to do a FNA on that. Here you see a little whitish tissue in there. Here you see a little more blackish and anechoic area as well. Here is it's like a mixed echogenicity, and it's right where the vessels are. And if there was really a mass, actual pancreatic mass, the cancer, not that it cannot be, but if that, mostly you would see a distal pancreatic ductal dilation, which we don't see. We actually are having a hard time finding the whole pancreatic tissue beyond that. And somebody just mentioned that she had a varices as well.
Yes.
Okay, so this looks really more like a clot in the splenic and portal vein to me. If you want, I can do a FNA, but it may be just all blood in there. This looks like a very typical clot. You guys see that clearly, right? There.
Yes, yes, very clearly.
Yeah, so I don't know if there is a need to do that. If you want,
You want to have a look at the body again and just make sure that they said that there's a mass. I don't think that we saw a mass at all.
No, this is, I think they're
This
saying
is the mass that they're talking about?
They are talking about, I think.
I mean, in your practice, would you FNA it?
I probably I might stick a 25 gauge needle there. Here you see a small cyst in the pancreas itself. This is a duct, small duct. And I really
Amjad has just made a point, and that is, although I haven't seen the CT films, but the CT is saying the mass is in the body, or is it the neck, or what?
I think they are telling me it's in the body.
The distal body.
Distal body.
Yes.
Well, I have seen worse reports, so I'm not going to make any comment.
Yeah, this looks like a very typical clot to me, to be honest with you.
Khalid, I'll leave it to you. If you want to stick a needle, go ahead. If you don't, it's up to you.
I think we need to take ask somebody else to take a look at the CT before we do that.
Okay, fine.
Yeah, it looks like a so typical of a clot. I think we should leave it alone.
Okay,
Yeah.
great. Khalid,
Okay.
just for the sake of completion, can we just have a look at the body again, please? Of the pancreas. If there is any, there is no body actually. We
no
didn't see
really
any
body.
body.
You don't see anything.
There was no
there.
body there. So
Yeah.
this has to be. This is what I'm pretty convinced. This is what they must have seen, and they thought this is the body.
Yeah. So here you see a lot of varices too, like
You can
collaterals.
see a lot of
right?
collaterals there,
Yeah.
and that confirms
So that confirms that it's likely is a clot.
So this is a very long process that must have taken place with
And,
multiple
yeah,
episodes of
multiple episodes,
possibly-
and we don't really see a pancreatic tissue anywhere major.
yeah.
It's a like complete atrophy.
They describe the mass as hypodense, exophytic, heterogeneous nodular mass lesion at the level of distal body. Not
I don't care what they describe. We have seen the.
It demonstrates internal septations debuting the splenic vein anteriorly, which is also between the acer curvature.
Where was this CT scan done and reported, please?
ARC.
Oh. Now that's a. And who's signed it? को देखना जरा यार. नाम किसका?
Rashid Ahmed.
Rashid Ahmed.
Khalid, can you just Khalid,
Ji?
this is Mustafa here. Can you just show us the clot? And I think when you were going clockwise towards the body, if you just go clockwise towards the body, or where you would expect body to be, just take a look there. So,
So here it is. You see
Yeah,
that?
yeah.
Clot right there. You see
Yeah.
that clot? That's
Yes.
clearly a clot.
so just
Yeah.
as you pull back a bit and go clockwise, right there. Keep
Nothing.
going.
Yeah, nothing there. And that's still there. That's,
that's
clearly a clot there. It's hanging in there. And there's like really, you don't see here. When you get to this point, it gives you an idea. Maybe there is a mass there, but you more carefully you look at it, it's like a vessel with a
Yes.
clot on the side. Here you see that. But if
Yeah.
you turn it to the right, it looks like there may be a mass there, but it's the same process. So I really don't see anything there. This we can. I think if we can get the CT read again and then stick this area. It sometime a tumor clot or a tumor itself can look like a clot too, but it's this one is more to me. I don't see the rest of the pancreas, so I'm more convinced that it's a clot itself. If there was really a mass, I would see at least a ductal dilation distal to that. And the only thing I see is the collaterals there.
Yeah, there are a lot of collaterals
Yeah.
there.
So that also definitely supports that it's a clot. And they did not mention about anything about the clot itself. Yeah, I'll go straight to that.
Yeah, and then if you
Hold
get a-
on, just give me 1 second. I want to do one more thing. Let me see what type of waveform we are getting. The other possibility we got to think about is the aneurysm there. That's a venous flow.
Yeah. And then when you get a chance, just maybe do the tail view and follow it towards the body again.
Yeah, that's just a venous flow. Okay. Just give me 1 second right there. Here, you think this is the duct right there?
I don't know.
Yeah. It's really hard, like it's a something here without flow, but it just ends. No, there's no mass there for sure. That's a vessel there. This is a clot, so
Yeah. Maybe just one last look from the tail towards the clot.
okay, let's do this. I will come back to the aorta right there. I'm going to take the Doppler off.
So that structure.
You see, look at the pancreas
Yeah.
right there. Okay, it's a very atrophied. There's nothing in the tail area. I
Yeah.
will follow that towards the clot. Following that, I don't see anything there. There's a then you get into the collaterals, and from there you get straight. Those are all collaterals, right here, and you get straight to the clot.
Yeah.
The
other difficulty-
chronic pancreatitis, risk of splenic and portal vein thrombosis. Could it be that? Yes.
Yes, exactly.
Yeah, I think that's what it is. And with the collaterals and varices, this has to be just a clot, and due to chronic pancreatitis. So I don't really appreciate any mass there. And it's these are the cases where EUS is really helpful, and these are not the easy cases. These are challenging cases. But here I clearly can see everything there, and except the mass. Any other questions, suggestions?
Khalid, you've convinced us all here.
Yeah,
So you're good.
really, I don't see it there. Like those are all collaterals.
Yeah, yeah.
I put a Doppler on there, and these are all collaterals. Look at those. Okay, so I think it's I would call it clinically, the way it looks like to me is chronic pancreatitis as a risk of leading to splenic and portal vein thrombosis, leading to eventually varices. And I don't know if she has any symptoms suggestive of malignancy. Anybody knows about the?
She's just pain, complaining of pain.
Yeah, that's a problem. Okay, so I don't. I think should we stop, or we need any more demonstration? No answer. Okay, so ab dobara karo. This is also very difficult case because there is not much pancreatic
Is
tissue.
there a CT film there? Is there a junior doctor who's there, Sadaf or somebody?
CT film है यहाँ पे?
अगर है तो उसको यहाँ ले आओ प्लीज, भिजवा दो मतलब. अगर है तो फिल्म होनी चाहिए ARC की.
So the person who read the CT, it's a good reading, you think?
Yeah. I mean, if it's Dr. Rashid himself, then he's excellent in CT scan. He's one of the best radiologists Pakistan has ever seen. So
Okay, so right here, rotate it to the right. Rotate to the right. Keep rotating. Keep rotating. Good. To find the aorta. Fine. Keep going. Keep going. Keep going. Keep going. Okay. Go back a little bit. What was there? Right there. Okay. Hold on. Stay.
Khalid,
You see
Khalid,
that clot
you-
again? G?
Khalid,
G?
we are done here, so
Okay.
you can, whenever you want to finish off, we are calling it. We're
Okay.
starting lunch here. Okay.
Okay, sounds good. एक मिनट दिखाना सर Yeah, that's a clot. जी नीडल 25 गेज है ओके ला दो मुझे सर
वसीम भाई को बुलाओ
वसीम भाई को बुलाओ
वसीम वसीम भाई को भेज
Uh, 25 गेज तो मैं ज़रा देख लूँ अगर ये सारा ब्लड ही आ रहा है ना तो फिर तो क्लॉट ही है ये देखने में ये क्लॉट ही लग रहा है ज़रा वो उसका वो डॉपलर निकाल देना डॉपलर हटा दो पहले बी को दबा दो बी को निकाल लो स्टाइलर रीमा ने पूरा जोर लगा दिया था उसके ऊपर very soft मेरा सारा क्लॉट जी बहुत सॉफ्ट है हाँ जी अब इसका सक्शन
Khalid,
जी
we've had
we you see that I decided to do FNA
yeah Mrs. अपना Riyaz. She has just reviewed the CT scan and she says this feels like a clot.
it is a clot even by doing a FNA
It's very soft, easy going in.
very soft and
Okay.
I can see that it's a clot like
Okay.
I'm just by looking at it it's a clot
I
It's
believe
not.
you, the moment you said that.
Yeah. So what we're going to do is like we'll get some tissue like we should get some clot from here
Okay.
and then we'll make some slides. I don't want to do a second pass unless
That's
if we
sensible.
only see a blood then we're done.
I'll come and have a look along with you, okay? Otherwise, we have served lunch here, okay?
Okay.
We're done with endoscopy.
And the reason I'm doing so many back and forth movements is I really don't want to stick it second time unless it is necessary. So I want to make sure I get enough tissue. Tissue or enough specimen, I should
Right,
say.
Khalid?
Ji? ठीक है.
Great.
Okay.
Thank you.
Thank you. एक मिनट ज़रा आप इसको होल्ड करना, हमें स्लाइड्स बनाने दो, अभी निकालना नहीं है इसको, ठीक है? कुछ ज़्यादा इस पे होना भी नहीं है टिश्यू इससे. स्टाइलट लेके आओ जल्दी से, इससे पहले कि ये क्लॉट हो जाए. यूजली मैं स्टाइलट को यूज़ करता हूँ. पहले आपको इन्होंने कहा कि फ्लश करो. हाँ, तुम्हें मेरी बात पे एतबार नहीं है? Needle बाहर नहीं है. It's a really nice case. So वो क्या कह रही हैं कि क्लॉट लग रहा है? Unless there is a tumor hiding in there, but we got some tissue there. I won't make a second pass until I'm because it's you are going into the vein right now. ये है उसके साथ आया हुआ है, उसको जरा अगले पे, हाँ अगले पे डाल. वो किधर गया मेरा ट्रेन ही, वो बेचारे की दोनों पे बैड लक. एक में है ही नहीं पैंक्रियाज और दूसरे में इतना बड़ा था मैस कि EUS की ज़रूरत नहीं थी. That was, it looked like a liver initially. I thought it's a liver, honestly. And then until I held the scope and I rotated, the liver is on the other side, and that's itna bada mass tha. It looked like a liver. I thought, you didn't see that. No. So वो उसके हाथ में स्कोप थी. मैंने कहा, oh, you saw the liver, and it looked like a very modern cirrhotic liver. I was like, it looks like a very cirrhotic liver with a big met in that. And चलो देख लेते हैं. अगर tissue तो must be a tumor with with a thrombus, yeah. But it's in the vessel, no question about that.
How can you have tumor with no?
Maybe from somewhere else. Okay. And her clinical picture, yeah, it's not. मैं tumor वो जो है ना. No, she's look at her. Yeah, exactly. It's and a tumor of that intensity, she should be checked.
She will totally take it.
Yeah.
She's so full. Patient देख के भी आपको पता चलता है.
हाँ.
इतना advanced कैंसर का patient ऐसे थोड़ी होगा.
वो शुरू 40 BMI से करते हैं ना, जब तक आते हैं तो फिर भी उनका 25 BMI. चलो मैं देखता हूँ 1 मिनट. मुझे तो एतबार नहीं है तुम पे अब.
नेक्स्ट स्लाइड में भी सैंपल अच्छा.
इस पे तो कुछ नहीं. मेरा ख्याल है कि ड्राइड आउट ब्लड है बस, और कुछ नहीं है इसमें. आप देखो ज़रा एक दफ़ा देखो पहले. यू एग्री? नहीं, इसको देखो पहले. क्या ख्याल है? कुछ भी नहीं. ये सेल्स हैं या सिर्फ सारा क्लॉट का चक्कर है?
But we asked for restriction, he said. So Khalid was there.
So उसकी pancreatectomy का लिख दिया recommendation? कल एक cystic mass था.
जी
So that's important.
He will need a minimal and extended.
RBC सारे RBC हाँ जी बिल्कुल वो तो सारे RBC लग रहे हैं। ओह ठीक है इंशाल्लाह ओके जी। वो ना फॉर्म्ड क्लॉट है ना, तो अगर ब्लड फ्रेश हो तो फिर वो ऐसा नहीं लगता, लेकिन जब उसमें क्लॉट फॉर्म हो गया इट्स अ क्लॉट all for RBCs and a single here and there, so that would be with the clot.
I put money on what you were saying. अगर नहीं होता ना तो you are dead.
चलो कोई नहीं, I do not see any cells there on the only. ये बेरंग है। Wasim update. I don't.
Sir, what should I mention in the report?
So dilated portal vein with a suspected clot in the portal vein, FNA performed to rule out malignancy. ठीक है? And atrophic, निकाल लो उसको मेरा, atrophic pancreas and suggestive of chronic pancreatitis. जी?
Looks like a clot fibrin type of material.
देखता हूँ। अब मुझे ऐसे केस सिंपल से ना दिया करें ना, सही बात है, वही ना मैं कह रहा हूँ
आपको ठग करके नजर आया।
हाँ, और
उसमें और कुछ